Yes. Are you able to hear me and my screen is visible, Dr. Gagan?
Yes, ma'am, go ahead.
Thank you so much. So, what I was trying to tell you here is that 9 out of 10 people who shy away from going for the NABH accreditation are worried about the documentation. But let me tell you one thing, that whether or not NABH, documentation is very, very important for your organization. A standard operating procedure for uniform patient care is the only way in which you can gradually evolve into an institute with a culture of quality. So what is the importance of quality in present day context? It has to be feature rich and error free. Okay, you're giving an extra cup of coffee to your patient could be a feature, but definitely it should not have any errors. Evolving public expectations, increased participation in decision making, advancements in knowledge, disease management, and instrumentation, and increased complexity in management of patients. All these things leaves you without any choice but to think about some form of quality improvement on a day-to-day basis, and documentation is your first baby step. So think, when you're now listening to this talk, do not think about NABH. Think about how you can now improve the practice in your day-to-day business as usual clinic life. Standard operating procedure is a fundamental unit for efficient and uniform functions. You will find a webinar which I have taken on how to write an SOP on public domain. If you have the 40 minutes time, you can sit with your staff and go through this webinar. A hotel front office training manual can have 231 SOP. We as a healthcare organization definitely should get warmed up about having standard operating procedures. And once the SOPs are in place in your hospital, you do not have to worry about any NABH related document. Uh, Dr. Kumran has very wonderfully taught us hospital infection control and has made it very clear that operation theater is one of the most important, dynamic, and complicated area where the safety of patient requires great priority. Besides that, you need to understand these are the documentation for hospital infection control and operation theater. A surgery list, surgery related medical records, registers, checklist for OT disinfection, checklist for day before surgery, on day of surgery, after surgery, terminal cleaning. This is a part of your hospital infection control, which is the most important manual of your organization. Is it mandatory because you're going for NABH? No, my friends. Biomedical Waste Rules 2016 mandates that any hospital who is generating biomedical waste should have a hospital infection control committee, a hospital infection control manual, and the minutes of the meeting every month should be recorded. So whether or not NABH, you should be having documentation for hospital infection control in your hospital. Sterilization protocols, the right way, the overloading. Imagine if this is all written down clearly. Imagine a world where if a new employee wants to join your organization, you're giving them a manual in their hand and saying, this is my Apex manual. This is a manual which talks about your vision, your mission, your quality values, right? Your safety guidelines, and the kind of impression your new employee gets. He or she is already getting warmed up to a culture where things are done with a proper system from the day one. In fact, in our appointment letters, we write that you will have to implement your duties according to the standard operating procedures. Any documentation which happens for hospital infection control, this is, for example, for monitoring, all the tests, patient documentation, every batch number of each cycle, sterilizer number, production date, expiry date, person responsible for production is going to be very important if you get one case of surgical site infection, isn't it? You need to validate that that particular surgical set, what was used for that patient, has been sterilized. And if you need to recall all the instruments or all the disposables used for that particular patient and see that they are not used for other patients, this documentation is going to be handy. So this is something which I want to tell you that every small documentation in your hospital has a purpose. It's not just because NABH is telling you to do it. So imagine a situation where a documentation where there is no SOP and with SOP. Without SOP, we already know what's happening. With SOP, the patient records are vital for continuity of patient care. Medical records serve as proof of proper care if any disputes arise. Accountability can be fixed with proper documentation. Recall is possible in case of surgical site infection. There are reorder levels, and like Dr. Gagan said, Lhasa drugs. So you will never be in a situation of a stock out, especially when you really need that particular medicine or disposable. An OT scheduler, a very important piece of your document. It cannot be scribbled, it has to be given the due respect, made correctly with all possible details, including the expiry date of the intraocular lens. And this is something which should be stuck in your OT when you're operating, even if you have that one case on that particular day. OT list, person responsible, and the list should be sent a day ahead to be handed over in person with the name of the doctor and the name of the nurse and to be put in the OT. This becomes an important piece of document. So accountability with key performance indicators, with theater managers, with the infection control team, with surgeons and with anesthetists. A risk readiness with surgical site infection, process maps, and escalation maps in case of sterilization failure. Your OT staff has put in efforts to make the SOP. From grassroots level, everybody knows that they have written this thing. This SOP has been reviewed and then approved. It is not a copy paste job like Dr. Nirmal was trying to tell us. And obviously the feeling of ownership and accountability of the SOP and the mood to follow it is much higher. The chances that it will be implemented is higher. A sterilization failure process map is the most important document in your operation theater, where your staff recognizes a failure and is empowered to stop a sterile load if they have any doubts of this of the sterility of that load. Can you see this bright flashing car? You need to intervene before damage occurs. Otherwise, something like this can happen. So surveillance and monitoring becomes a part of your routine activities. Dr. Nirmal also again told us about internal audits. This is all about what we're talking about, internal audits, and it has to be documented, right? We believe only in God. Everybody else will have to show a document. This is a protocol on surgical site infection. You're already ready that if an infection happens, what all you will look into. And a format is in place. This is a code blue form, which is already available in your hospital, where in a case where you have to call for a code blue and give a CPR, a basic life support, there is somebody who is noting down the minutes of meeting and a code blue form filled. This proves that in your organization, this patient had a cardiac arrest, a CPR was given, all the emergency resuscitation was given, and this is the minutes of the meeting. Imagine it becomes such an important document to prove that you have done all whatever you could in that particular circumstance. A grievance, a simple thing as a grievance, from a debt to a grievance. Imagine if there is a proper SOP for grievance handling. It is handled according to the protocol, and the patient will be more than happy to overlook the incident. Inventory management. If there is a proper documentation for your inventory management, for your medications, a proper reorder level, an economic ordering quantity, your first in, first out, just in time inventory. If this is happening correctly, then you will be sure that there are no stockouts. This is a copy of what we do, and it's stuck on our refrigerator. A clear level of reorder level is written over there for each drug. So whenever that number is reached, automatically it's a no-brainer that the medicine is ordered. And you definitely do not want something like this in your operation theater. Appointments, again, with SOP, there is a proper way in which an appointment is given. This is something which is beyond accreditation. You remember that when you want to follow NABH standards, only the standards which has an asterisk on it require documentation. Where it's written, documented policies and procedures are required. Or staff is trained. If staff is trained is written, that means you need training records for the staff. But what I'm talking about is a documentation at all areas of your hospital. A registration SOP. Demographic details and general consent is collected without fail. Now, is not required. Error-free billing and fees collection can give realistic waiting period to the patient. A standard operating procedure is something like this, where everything is written correctly, but you decide how you want. Nobody is expecting a crisp SOP from you on your first accreditation cycle. Something what you have done, what your staff has done will be really valued. A process map is a part of your standard operating procedure. For example, this is a process map for registration and billing. Here, clearly there are prioritizing levels written so that the staff, the front office staff knows that if a patient has eye injuries, vulnerable patient, or an infective patient, they have to be prioritized and fast-tracked. How simple this can be. Investigations. With an investigation, there will be correct reading, accurate calculations. A consultant, when the patient goes into the doctor's room, the first 3 minutes is the time when the doctor decides. Actually, thin slice is the doctor. The patient decides how good your doctor is. If the doctor is tuned to working with a particular SOP, then obviously the treatment and plan of care will be uniform. There is a format in which the initial assessment is done. Counseling. If there is a proper counseling SOP, the patient will be able to make an informed decision. Patient will feel confident of the hospital's efficiency because all the queries are answered in a systematic manner. And patient will be compliant with the treatment plan post-operatively. Insurance. Again, with insurance, patient will have clarity about the conditions which are in the control of the hospital and the areas which the hospital are not responsible for their insurance claims. The outcome is that you will have less unhappy patients. This is our team, Zamindar, and I should say that anything what I do or say, I have a lot of support from my team always, and I am always thankful to them. We do run a knowledge sharing platform once or twice in a year, and if you do have time, you can join us for this learning and sharing and brainstorming activity. Thank you.